Well, just hours ago, Sacramento County declared monkeypox a public health emergency. This will allow the county to receive more funding and resources. Keep in mind, the state declared an emergency on August 1st. Meanwhile, in the Reiner report tonight, the state just held the very first hearing on monkeypox. Lawmakers heard from a panel of public health professionals and a person who tested positive for the virus. ABC 10's Morgan Reiner was there for the meeting, and Morgan, the meeting ran for several hours.
Chris, between everyone who spoke in the room, there's easily at least a dozen steps they believe need to be taken to help address the monkeypox outbreak. One of the big ones is giving full approval to a medication they say proves relief and provides relief to patients suffering. But there's so much red tape, they say, it takes hours before a doctor can maybe prescribe it.
Video monkeypox will come to order in 60 seconds.
Speaker after speaker at Tuesday's First Select Committee on Monkeypox drew the same parallel.
As someone who entered public service as the HIV crisis began in the early 1980s.
Thank God that monkeypox is not deadly like HIV, but people are suffering.
Each one saying California can do better.
I cannot believe it's 2022 and under a Joe Biden administration, this is still something that we have to rally for.
Jack Hebb is Castro proud.
The gayest neighborhood of San Francisco.
He traveled to the Capitol to give public comment, hoping to fight for his community where he says everyone knows someone who has it.
I ended up in the ER 3 times over the course of 4.5 days.
David Watson knows the pain firsthand. He ran into a friend on the street, gave him a kiss on the cheek, only to find out there was a monkeypox lesion mistaken as an ingrown hair.
It didn't matter whether I was sitting, standing, or lying down, the pain was off the charts.
There are 300 to 400,000 people in California, the state epidemiologist said, are at risk of becoming like Watson.
We need more testing. We know right now the only test that the FDA has approved is swabbing the lesions from monkeypox. So if someone doesn't have lesions, or if the test is done incorrectly, their test may be falsely negative.
Senator Scott Wiener, the leader of the committee, ran through a list of steps that need to be taken.
You might have to isolate for 3 or 4 weeks if you get monkeypox. And for people who can't work from home, they need to have paid sick leave.
Now, the state also said they are exploring more telehealth options for patients because right now all patients are required to get screened. And they said if you're lucky enough to get that medication, well, then it turns into several different times that you have to get screened.
And you know, Morgan, I can't help thinking that many people need to pay attention here. For so long, I was thinking they were saying this was something that was perhaps spread through sexual contact. But then to hear him talk about how he just kissed a person on the cheek and then ended up with the virus is quite a different story.
Yeah, and then he said his husband and his 2 dogs got it as well. You're right, there are a lot of misconceptions that this all happens within one community and that it happens over an extended period of contact. But like you said, it was just one small kiss on the cheek. So it is quite, I guess, alarming to hear something like that.
Of course. Keep us posted, Morgan. Thank you. Meanwhile, many college students are starting school in less than 2 weeks, and the possibility of monkeypox spreading is a big concern. Many college officials say the COVID-19 pandemic has prepared them to respond to outbreaks. They plan to focus on education, prevention, and their response to any cases of monkeypox on campus. We spoke to students about their concerns.
Hopefully it doesn't get bad, but it seems like there might be, college kids are going to be very affected by it just because of our closeness and, like you mentioned, the partying and the kind of nature of college.
Another thing to consider is that monkeypox requires a longer isolation period than COVID-19, and that may be a challenge for both students and universities.